Welcome everybody to our first virtual Q&A session. My name's Ian Dodds and I'm the Director of Children's Services for Richmond Council. The purpose of us coming together this evening is to provide you with the latest information we have about the COVID related measures that will be in place when children return to school in September, and to provide you with some more information on the vaccination rollout for children and young people in our borough. So joining me tonight are Dr. Patrick Gibson, who is a local GP and the Richmond lead for NHS South West London Clinical Commissioning Group. And also I'm hoping joining me is Asthma Nisa, who is a consultant in public health at Richmond Council. And they're going to give you a short presentation in a few minutes before we open up to questions and answers. But before we go any further, I do need to run through some guidelines for this virtual event. So to tell you first of all that the event is being recorded and will be published afterwards on the council website for those people who were unable to join us this evening in person. Everyone, you'll notice, is muted except for the panel members. If you wish to speak or ask a question at the end of the presentations, then please use the virtual hand, which is at the bottom of your screen on Zoom. And please think about the questions that you want to ask during the presentations. If you do speak, it would be helpful if you could turn your camera on if it's off already, but if you would prefer not to do that, then that is equally fine. Please also use the chat function, and you'll see that at the bottom of your screen as well, to share your views during the presentations and during the question and answer sessions, and we'll try and weave those into the discussion. Please try to keep your questions brief so that we can get through as many of them as possible, and please try not to repeat questions that have already been asked and answered. You should have all been sent the event etiquette guide with your email confirmation for this evening, and I know that I don't need to remind you of the need to be respectful towards everybody in the meeting. After the event, we'll email all the information that has been given this evening and that has come out of this evening's question and answer sessions to you. So that's all I had to say in terms of the procedure for this evening's meeting. But before I move on to the first presentation, I just wanted to spend a few minutes acknowledging how challenging the last 18 months have been for children and young people, and indeed for you as families, and also for schools who have had to change their approach to teaching and learning, take on new roles for testing and tracing and managing confirmed and suspected cases in their classrooms. And although most children and young people have remained impressively resilient and adaptable to the restrictions that they've been placed under, a small but worrying number of them have and continue to have additional challenges, particularly with their emotional health and well-being. And I see that in my role more and more at the moment. So that's why I think it's important that we have a safe and well-planned return to school in September. And I hope this evening we can give you the assurance that you need, that schools have done the planning that they need to do and are looking forward to safely welcoming back children into their classrooms in the next couple of weeks. And also that there is a really effective plan in place to roll out the vaccine to eligible young people. So I hope you get that assurance in the presentations this evening, but if you have any questions, then please put your virtual hand up and we'll come to you when we reach the question and answer session. So I'm going to check to see if Asthma is now in the meeting.
Ian, Asthma is having a few problems joining, should be joining shortly, so perhaps
okay. So I'll swap the presentations around and invite Dr. Patrick Gibson to give his presentation first. Is that okay, Patrick?
Thank you very much, Ian. That's great, and thank you for inviting me today. So I'm Patrick Gibson, Dr. Patrick Gibson. I'm a GP in Barnes, and I'm the lead for COVID vaccination in the borough of Richmond. and the GP lead for Richmond in South West London, CCG. All of the local practices and other NHS services have been working flat out, as I'm sure you all know, since December, to make vaccination as accessible as possible for local people. And it has been a huge effort to manage this in addition to the usual workload. And I would like to begin by thanking everybody who's been involved in that amazing effort to vaccinate our community and help to keep everybody safe. And it's certainly not only our NHS and social care staff who've supported that. We're blessed in Richmond to have the most extensive voluntary sector in the country, and many volunteers have given up their own time and offered additional resources like tents, for example, to support our efforts and help us to try and get back to some sort of normality. So we're incredibly grateful to each and every one of them, as without them it simply would not have been possible. I'm really pleased to say that the public response to the COVID vaccination programme has been fantastic in South West London, with Richmond actually leading the way amongst the 6 boroughs. More than half of all residents have been vaccinated in the latest borough figures, which were available in mid-July. We've got near 90% of our over 60 population vaccinated. So although COVID is still present locally, it's clear that the vaccination programme is helping to keep people out of hospital, and that is obviously really, really important. So as of mid-August, the data indicated that 4 million infections have been prevented across England alone. 82,000 hospital admissions have been prevented. And today's PHE report, which you may see in the press, illustrates that somewhere between 102 and 109,000 deaths have been prevented by vaccination to date. And we're already in the happy position where 75% of our 18 to 24-year-olds in South West London have had their first jab. So everybody over the age of 16, as of the last 10 days or so, is now eligible to have the COVID vaccination, which is where we are today. And that's a real positive. It's a real statement of how successful we've been in moving through this programme. And some children, and I'll come to that a bit later, aged 12 to 15 are now eligible too. And we're anticipating an imminent announcement about wider availability for the 12-year-old plus population, possibly even in the next few days. Significance of COVID infection in children, it's obviously less to do with the likelihood of hospitalisation or severe disease. We knew quite early that, as Ian pointed out, children are quite resilient in terms of COVID, and deaths in children due to COVID have been extremely rare. Mortality seems to have been consistently at about 0.01 to 0.1%, so 1 in 1,000 maximum, and that's quite heavily weighted to comorbidities. But we have, there are some studies which look at long COVID in younger people, and there's one Russian study which actually estimates that 25% of young people who get COVID do have some long COVID symptoms. So having said that, it's much more to do, the reason for vaccinating is much more to do with the impact of COVID on the social and emotional development, the capacity to travel and the learning potential in our young people. And Ian hinted at that at the start. COVID's been reflected in the disruptions to their schooling, restrictions to their socialising, and the mental health impact of children and young people has been really significant, not only in our borough, but across the country. There are some subsets within that younger population who've been more negatively impacted, and they're predictable really. So children with special educational needs, for example, where one-to-one support from key workers has been limited, perhaps because of availability in those key workers through illness or having to, I've got a blank on the word, keep away from other people. You know what I mean. I'm sorry, I can't, having a mental blank there. So that's put more pressure onto families. So the families of children have really noticed that there's less support around for them. So looking to the future, we're also concerned because we are seeing examples already where tertiary education and employers are stipulating that individuals are vaccinated before places are made available. So obviously we've got the spectre there potentially of a negative impact on life opportunities for our children and young people. And I think they've got it tough enough in this day and age without that as well. So we need to do what we can to try and help them with this. The reality is, I mean, some people would hope maybe the virus is going to go away as an issue. The reality is, while the virus will continue to evolve and it will change, it's in that group of viruses which is unlikely to go away anytime soon. It's in that same group as the flu virus. So we're likely to have to live with this for some time. So having said that, I really don't want to give the impression that it is the job of me and other health professionals to bully and to nudge people into vaccination. It is really, really important that vaccination is seen as a voluntary exercise and that people should not feel pressurised into having it. What health professionals need to do, and what I hope to do today, is to try and offer the best quality information I can at any given point in time, because that information does change as more data is gathered, and to help people to make the best decision for them, really. So many of you were helpful in advance of the meeting to submit some questions, which I'm going to try and work through as part of my presentation now. But there is obviously time as well for question and answers later. And as Ian and Elliot said, the chat function is there, and please feel that you can put questions in there. There's no such thing as a daft question. Doesn't matter how daft you worry it might be. It is the right question if it's one that just helps you to get some clarity. So who's eligible now? Who under 18 is eligible for COVID vaccination? We've basically got three categories. The first one is the one that was announced about 10 days ago. So everybody over the age of 16 is now eligible for the vaccine. They should have had contacts to have that vaccination. So if you have people who are under 60 or are 16 to 18, over 16, and haven't had a contact, and please, now is the time to stop contacting your practices in the first instance. For many of those individuals, the contact point we have for them, for the practices at least, is their parents' mobile, and obviously that's not infallible in this day and age. So if you know of over 16s who haven't been contacted yet, we are ready to do them, so please do contact your GPs. The second group, in line with the Joint Committee for Vaccination and Immunisation guidance, is children aged 12 to 15 with severe neurodisabilities, Down syndrome, conditions which are associated with immunosuppression or drugs that are associated with immunosuppression, and multiple or severe learning disabilities. The reason that we're targeting that population is because we know that they are more at risk of the complications of COVID. I talked about the mortality being heavily weighted towards comorbidities, and that's the rationale for bringing them forward ahead of the other 12 to 15 population. Early on, we accessed, before we got to this group, the parallel group in the 16 to 18-year-olds were prioritised again before the rest of the 16 to 18 population. So that's the second category of under 18s who are eligible now. The third category is young children, young people and children aged 12 to 17 who live with an immunosuppressed person within their household. Now, immunosuppression is it's a difficult one for people to necessarily completely understand. If there's any question about somebody in your household being immunosuppressed, have a conversation with your GP, because they are the people who are best positioned to tell you whether that person is at risk of complications of COVID, because that's where the definition of immunosuppression comes in, really. And the rationale, obviously, for vaccinating those young people in those households is to protect their immunosuppressed household contacts, rather than primarily because of those individuals. So the next very good question we had was, when will vaccination appointments be available, and how will patients access them? So everybody under 18 should have received a letter from either from the national booking service or from their GP or from both, or a contact from their GP, maybe a text message, inviting them to be vaccinated and explaining how to get booked in. In terms of how to access the appointments, there are several possible avenues. We've had an excellent walk-in service available at Harlequin Stadium, and that's in place until Monday, and they've been offering that for our 16 to 17-year-olds. The support we've had from Harlequins has been fantastic in the last few months, and we're extremely grateful to them for everything they've done for the NHS and our local people, but they have to make their site available for its primary purpose because the rugby season starts next month. So we lose them, but we have lots of other sites. We've got walk-in opportunities, walk-in appointments available at the Teddington Health and Social Care Centre, and beside at the back of Teddington Memorial Hospital there. And that's open Monday to Saturday, 9 AM to 3 PM. We've also got the mass vaccination sites, which are staying open. So while Queen's is closing, Queen Mary's Hospital and the Hawks Road site in Kingston both remain open. A number of local pharmacies in Richmond are also preparing to offer COVID vaccination, and some already are. And the local NHS and the councils will continue to share information about this, about which pharmacies that is, on their websites and through social media once those pharmacies have gone through the necessary accreditation process to be allowed to do that. If you happen to be on this call and you're a Kingston resident, again, you can find out that local vaccination service on your council's website. I do actually have a list of the pharmacies if anybody wants to know those later. So the aim is to make vaccination as easy as possible for you to access and for the young people to access. And we've adapted the offering as time's gone along to accommodate the different cohorts. We know that this population, we do need flexibility. So we've observed that some young people have been motivated to make the bookings. So we know that they're keen to, but then they get a better offer and miss the appointment, and that's fine. You know, their lives are more fluid and they're livelier than mine. And if they get a better offer, that's great. And what we need to make sure is that we're offering as flexible access as possible, so that there's another early opportunity to be jabbed, so that we can get on and protect them. So we know, for example, the pop-up clinics at sports events, sports fixtures, and walk-in clinics have worked well for many. And I think Reading Festival is doing a pop-up this week. And given that half of Richmond decamp, or that population in Richmond decamp to Reading, and that may well be a useful site for them. I haven't mentioned the practices that continue what we call the local vaccination centres, who are still offering vaccination. There has been a reduction in some of those local vaccination sites. We set them up as in line with the new primary care network structure that's been taken on in the health service. What a primary care network is an amalgamation, usually of practices that are close together, who come together to deliver particular services, and one of those has been the flu vaccination. So the principle behind it is that a population of 50,000 or so is identified, because there are efficiencies to be gained by doing things at that level, and that there is good evidence that population health outcomes are better when targeted at large populations in that way. So the two sites that continue to run at the moment are the ones that come from Essex House Surgery in Barnes and from the Hampton Wick site. The Greenwood Surgery, or the Greenwood Health Centre, is going to start doing phase 3 vaccination of boosters, but is not currently delivering vaccines at the moment. So I've covered the conditions. So the next question that we came to was what COVID vaccines are actually being given. So at this time, Pfizer is the only vaccine authorised for children aged 12 to 17 in the UK, 12 to 18, in fact, in the UK. Moderna is eligible for the 16 to 18-year-olds, but we have not had much supply of Moderna. So in practical terms, Pfizer's been the one that's been around. Really important question that was asked in advance was, what are the side effects? And they're usually mild, and they should not last longer than a week. So if anything is lasting longer than a week, we should be looking for other factors. The commonest one by far is a sore arm from the injection. People often feel tired for a day or two, maybe a headache, feeling quite achy, feeling a bit sick, a bit nauseous, not uncommon. Fainting is much more common in the younger population than it is with the older population, and we've witnessed that as we've gone down through the cohorts. But obviously we're well and truly prepared for that nowadays. So nobody gets alarmed. We just get on with dealing with that if it happens. Very occasionally people get a minor temperature with it. It should only be a minor temperature. So if anybody gets a significant temperature of 18.5 over and 98.5, then what we should be doing is looking for other causes. So it should only be a minor temperature. One important thing that's had a lot of press coverage, there have been some reports in the UK and in other countries of an extremely rare event with some inflammation of the heart muscle or the membrane around the heart called the pericardium after use of the Pfizer vaccine. This condition is not uncommonly seen with viral infections, so it's relatively familiar. It's probably related to the immune response that goes on to the virus. The reports to date are reassuring, though, in that this is not life-threatening. It's a transitory effect, and it doesn't have any lasting impact for the individuals. But obviously, these reports will continue to be very closely evaluated by both the Medicine and Healthcare Regulatory Authority and the Joint Committee on Vaccination and Immunisation. So currently, for that 12 to 15-year-old group, we're waiting for national guidance on that, and that may well happen in the next couple of days. So very much watch this space. One interesting question, which is interesting to not only some of the people who submitted questions in advance, but also interesting to the doctors. At the moment, there's a recommendation that only one vaccine is being given at the vaccination hubs when lots of 16-year-olds have had two. So currently the second dose is only being offered to 16 to 17-year-olds who are in the at-risk group. We know the best response is where a second dose is given at 8 weeks and not earlier than that. So we are expecting clarification from the Joint Committee of Vaccination in that time frame, so i.e. in the next few weeks, for that wider 16 to 18-year-old population. And it may well be that we end up calling them back in for a second vaccination at 8 weeks, but we are waiting for guidance nationally on that. One question that's put in advance was why the sudden change, apparently the sudden change to vaccinate under 18. So it isn't really a sudden change. So to be honest, since the campaign started, the needs of different risk groups have been considered sequentially as we work through the cohort. And it's just time now, it has just come round to obviously looking at this population. As the different cohorts have been managed, have been dealt with, there's been learning from each group and changes have been made. So for example, AstraZeneca has stopped being used for the population under 14. And the balance throughout the process has always been looking at the benefit risk reward ratio, and that remains the governing principle as each age group is being considered. And it is only going to be when that assessment of the benefit risk ratio is decided that a next cohort will be undertaken, really. So one important factor in this population is that vaccinating under 18s will help to reduce the risk of onward transmission from children to adults in school and at home, which obviously has implications for their ongoing learning. It means that young people can go back to school with increased protection against COVID-19, and getting vaccinated is the single most important step we can take to protect ourselves, our families and our communities against the virus. So obviously we would encourage on that basis. The long-term safety concerns or some long-term safety data with the vaccines. There was no rush with approving these vaccines. They went through exactly the same regulatory process as any other vaccine does. So every year we have the same process for flu, and COVID had to go through the same thing. We had some advantages with COVID in that internationally there was an initiative to DNA sequence the virus early. So they were able to get the structure of DNA very, very quickly for this virus, and a new technique allowing messenger RNA production meant that it was possible to actually manufacture it in a different way from previous ones. But there were no shortcuts taken on the safety bit. So even when we launched it back in December, there was a lot of safety data then. And obviously we now have the massive advantage that I can't remember exactly how many million we've got. Is it 40 million, 47 million in the UK have now been vaccinated? So there's a massive data bank there of safety. So we know it's safe. It is obviously true that as time goes on, we learn more about it, and we will incorporate all that learning into advice we give, and that's illustrated obviously in the decision to change from the AstraZeneca for the younger population. But any COVID vaccine that's approved has to go through the clinical trials and the safety checks of all of the other licensed medications, and it follows international standards on that. This can take So when's the best time to have a COVID vaccination if you've already had COVID? And obviously with the circulation in our population at the moment, and that's quite a key point. The recommendation is that there should be an interval of 28 days if somebody has had a positive COVID test, or 28 days after the symptoms started before somebody has their COVID vaccination. So that is largely because what you don't want to do is to be exposing other people in a vaccination centre to the risk of transmission from that COVID positive individual. Question submitted about safety of pregnant women. Yes, it is recommended for pregnant women, and pregnant women in the last trimester of pregnancy are at significant risk of complications of COVID. And there have been some desperately sad cases reported in the press. I think there's one today. Vaccination is the best way to protect against the known risks of COVID for both women and for the babies. And this includes reducing the risk of admission of women to intensive care and to the premature birth of children as well. So we are encouraging pregnant women to be vaccinated, and there's a real push on that in South West London. And we had one particular question from somebody who had a youngster who has Hashimotos and an enlarged spleen, but was keen to be vaccinated and wanted to know what the particular issue is. Hashimotos is relatively straightforward. That definitely would not be a problem. Where you've got a specific query though about a particular concern, so the enlarged spleen would be an example of that. What you really need to do is to have a contact with your own GP who will look at that history and best placed to advise about the enlarged spleen. If there's been a full workup and we know that enlarged spleen is not of any pathological significance, then it should be possible to be vaccinated. But the person to give you that straight answer is going to be your own GP. Asthma and people under 16. Early on, there was a lot of attention to COVID being considered as a respiratory disease primarily. As time's gone on, we think about it slightly differently now. It's mainly a problem because of vascular problems. So it's the thrombosis that goes with it is the big issue. And therefore, we've got a little bit softer on the asthma population group. So asthma in itself would not qualify somebody under the age of 16, but as I hinted earlier on, we are expecting very soon that the population under 16 are going to be included as the next cohort down. And we had a really, really good question in advance about trying to personalize care for particular subgroups of patients as well. So an excellent question about somebody who has a child with Asperger's, and just asking what consideration can be taken for that. Ian is doing a lot of work along with one of my clinical leads on trying to get a culture established across the practices and the hospitals, not only in relation to COVID, but around all care delivered to patients in particular situations that that reflects the need to take a different approach with some populations. So we've already given it a considerable amount of thought, and there are other cohorts with this sort of complication. So, for example, adults with learning disability who are in those higher priority cohorts. And the guiding principle governing care that's been established around this is that health and care professionals should be making what's called reasonable adjustments to ensure that inequalities don't emerge because we've got a rigid mode of delivery. So we're therefore encouraging carers to have a conversation or individuals to have a conversation in advance with their GP so that we can work out a personalised plan for them. For example, bringing an individual in before a vaccination session starts, so before everybody else arrives, or coming in a short time after when everybody else has left, so that it's back down to being a quiet, calm environment. We've been holding vaccination clinics in a variety of centres to reflect that as well, and we've had our vaccination leads are working hard to ensure that sites are as accessible as possible to all patients. And across South West London, we've delivered in sensory clinics, in learning disability clinics, we've vaccinated patients in their cars, and we've even on occasion vaccinated people in their homes. So whatever it takes, we will do what is necessary. So I think I've come to the end of the questions that have been submitted in advance, Ian, and I'll maybe hand back to you and take it from there.
So thank you very much, Patrick. That was really comprehensive, and thank you for picking up all of the answers to the questions that were submitted in advance. If anybody has any questions about anything that Patrick has said, or indeed hasn't said, feel free to put your hand up now, and then we'll come to those when we have heard from Asthma, who's going to talk more about the work that's going on in schools in terms of preparing for the return in September. So feel free to put your hands up now, and then I'll come to you after we've heard from Asthma. So I'll hand over to Asthma now. Welcome, Asthma. As I said at the beginning, Asthma is our public health consultant at Richmond Council.
Thank you, Ian, and thank you for allowing me to join a little bit later. I just had a few technical problems. If I'm able to share my screen, I'd like to present. I've got a presentation ready. And are colleagues able to see this?
So we can't see it at the moment.
As Matt, if it's easier, if you want to quickly email it to me, I can share my screen.
Okay, thank you. That's really helpful. I'll do that now.
So while we allow Asmat to get her presentation up, there is a question already, Patrick. I don't know if you want to answer it. It's from Rika, and she says that she's being, or he, I don't know if it's a man or a woman, I apologise. I'm being investigated for autoimmune disease. Would I be able to get my children, 11 and 13, vaccinated?
Thanks, Ian. I was frantically typing there an answer to Rika, so I'll just read out what I've got how far I've got with it. So thanks, Rika. So it depends what the nature of the autoimmune condition is. It's probably not, but the key determinant, as I hinted at earlier, it really depends on whether there's any associated immunosuppression with it. I don't think the 11-year-old, even if there was immunosuppression, I don't think your 11-year-old would be licensed to do that at the moment. Your 13-year-old would be, though. Your GP is best placed to tell you, though, whether your condition is associated with immunosuppression. In terms of your 13-year-old anyway, the JCVI we know make statements at intervals, and we are expecting their next statement tomorrow. And it may well be that the statement tomorrow starts talking about the 12 to 15-year-old population, which obviously will cover off your older child, but not necessarily your 11-year-old yet. So I hope that's helpful.
Thanks, Patrick. Let's go back. Have we got Asmat's presentation now?
I have sent it across to Ellie. I'm not sure if it's come through.
Okay, did you want to make a start, Asmat, and then we'll catch up with the presentation?
Okay, no problem. Here we are. Thank you for that, Ellie.
Sorry, I'm just checking I'm sharing the right screen.
You were.
Oh, fabulous. There we are then.
Okay, Asmat, you appear to have muted yourself. So you want to unmute and then start the presentation. That would be great.
Are you able to hear me now? I'm so sorry.
No, I can hear you loud and clear. So off you go.
Fantastic. Thank you very much. So I'd like to present some changes to the government guidance for schools in September. Just moving on to the next slide. So I think it's quite important to understand what the current picture looks like in terms of surveillance data, and the public health team regularly review the surveillance data. So I'd like to share that. I'll also share some changes in the guidance and perhaps go through some of the JCVI updates, but I know that Dr. Gibson has already gone through some of those, so I won't dwell on those too much. So this graph really shows us what's been happening as a trend in Richmond. So we know that around May time, the laboratory confirmed cases were quite low and reduced. So we were getting a rise in the number of cases throughout June and July. It peaked, the number of cases peaked around the end of July, and now we've seen the curve go down. So we've got a reducing number of cases that we're seeing throughout the August period, whereas in the, just moving on to the next slide, we know that there's been a slight increase in the number of cases, in the incident rate in Richmond over the last 7 days up to the 22nd of August compared to the previous 7 days. So when we compare this with Richmond's incident rate with London, we know that that is higher than the London average. So just moving on then, in terms of PCR or test positivity, we know that the rate in Richmond has increased recently in the last 7 days. And when we compare that to London, again, we are looking as if we are higher than the London average. And just moving on then to the next slide. So this slide is very busy. You probably won't be able to see it very clearly, but the key thing is to look at the intensity in colours. So on the vertical axis, we've got the age range, and then at the bottom on the horizontal, we have the date. So in terms, what this slide is showing is that in terms of age-specific rates, we can see that for the age ranges 11 up to 24, where the colour is more intense, we know that the incident rates are higher. And the incident rates in Richmond are particularly higher amongst the 17 to 24-year age group. So just moving on then to the next slide. Thank you. We can see that our picture around vaccinations in Richmond is we have a very good and very high vaccination rate for the eligible population, with dose 1 around 94%, and 86% for dose 2 in the eligible population. So that really shows that a lot of people have come forward, and our rates are pretty high. They are actually one of the highest in London. So that's good news. Just moving on then, looking at the key changes in government guidance. What we can expect from September are a number of changes. So, for example, there's no longer a requirement for schools to have bubbles or to reduce mixing in groups in education and childcare settings. There's no longer a requirement or a recommendation, no longer recommendations for schools to have face coverings in education and childcare settings, but there is still a recommendation that those who travel on school transport or school buses or travel to colleges, that face coverings are worn on transport in the transport setting. There's guidance around appropriate cleaning and hygiene regimes, and that still remains really important within the school setting and within other settings in the community as well. And this is really to help reduce the spread of COVID-19 infection, and particularly around the winter period. Ventilation still remains important. It's important to keep rooms ventilated so that the air circulates freely throughout, so that there is fresh air coming in. So that's still key and very important. In relation to contact tracing, so contact tracing by the NHS test and trace service will be limited to close contacts now, and schools and colleges and early years are not asked to undertake routine contact tracing. In relation to testing, students at secondary schools will, once they start the autumn term, they'll be asked to take 2 tests on site, after which they'll be required to test twice weekly in their own home setting, and that will sort of stay in place till the end of September. All staff across all education settings will be asked to test twice weekly at home until the end of September as well, and the government hopes to review this after that date. In relation to self-isolation, so the change there is that fully vaccinated adults and those under 18, regardless of vaccine regardless of vaccine status, will not be required to self-isolate. And finally, 16 to 17-year-olds can get the vaccine, and also 12 to 15-year-olds with underlying health conditions, or those who live in a household where there is somebody in the household who is immunosuppressed. They will also be eligible, and that's something just confirming the same thing as Dr. Gibson mentioned earlier on. So those are some of the key sort of fundamental changes. Moving on to the Joint Committee on Vaccination and Immunisation statement. So this is on the COVID-19 guidance. I think that most of these areas have already been covered by Dr. Gibson, and I think that the main thing from this particular slide is that the only vaccine authorised for persons aged 12 to 17 in the UK at the moment is the Pfizer vaccine. So that's a key thing from this slide. So just moving on then to the next slide. The Pfizer vaccine it's usually given in the arm. It's found to be safe according to the trials and the research. The most frequent sort of adverse reactions that people around the 12 to 17 age group might see are, injection site pain or a little fever perhaps, or headache. But generally, these are mild symptoms and self-limiting, and also very short-lived, typically lasting around 1 to 2 days. We know that there is further data on the experience of the relevant sort of experience of the vaccination that's being collected and is being accumulated, or there are systems in place to accumulate that data for 12 to 15-year-olds, and will be shared once that's compiled by the government. So moving on then to the next slide. This slide is really basically a reassurance sort of slide to say that, you know, we are assured that in the education setting there is a monitoring and review sort of system. There are measures that are in place already, and that there is a process in place when children go back and young people go back to schools, so that there isn't the worry that things have lapsed, but there are robust measures in place. So that's really just a reassuring slide. Moving on then to the next slide. Here's some of the key messages in relation to going back to school in September. So education is an integral part to a child's social and emotional development, and to get back to their education setting is key, and it helps children get back on track. So that's really key. The Department for Education are very keen to get this message out, and I think it's a key public health message as well. Some of the other key messages, I'll just go through one or two of some of the key messages rather than go through all of them. Children are at very low risk from becoming seriously unwell from COVID-19. So that's quite key, and that's been a consistent message throughout. By September, all teaching professionals will have been offered the vaccine, and by October half term, all professionals should have been double vaccinated, and the aim is to ensure that they are double vaccinated, and efforts are in place to do that. Children, the other thing, key message is that children to take 2 tests on site at the start, and then 2 tests twice weekly, but I've already sort of mentioned that in my previous slide. So those are some of the key messages that are coming out, and the rest of the messages are there to share if anybody would like to see the slides. Just moving on then to the last slide. This is just here we've just got some really useful links that might be useful for parents and for schools. These are all available to on websites. They are publicly available. So there's further guidance for parents. There's also the teaching blog and an education hub, and these are all there for to be shared and easily accessible. So thank you. That's the end of my presentation. Don't know if anybody has any questions.
So thanks, Asthma. As before, if anyone has any questions, if you want to put your hand up. I thought I recognised one from Den in there. So if you want to ask your question, Den, do you want to wait till you're unmuted and then you can ask the question?
I'm inviting Den to be unmuted, but he's not accepting the invite.
Okay. Well, there is a question from Cheryl. Shall we try unmuting Cheryl and then, well, I can see on my screen, so.
How's
So
that?
Cheryl, you're unmuted. Do you want to ask your question?
Yes, thank you very much. I really appreciate that you have organized this session, because there are a lot of concerns of parents. And I have to say, as a parent of a primary age child, I can see how the changes might be workable for secondary school where you have the testing, but for primary, it seems all we really had were the contacts and the isolation of the bubbles, and now that's been removed. And we have stories coming out of Scotland of household members testing positive and sending their kids to school because that's allowed, and then they proceed to infect other children. So I would like to be reassured, but I have to say I'm not. I'm really concerned about this change, about the contact tracing and isolations and household members testing positive with kids going to school. And is there any reassurance available, or maybe no?
I think that although it's not mandatory to have bubbles in schools, I think that some schools may choose to still have the bubble system. I know that in many areas like Lancashire, for example, there was a headmaster there that was talking on national television. Their particular school had decided to retain the bubble system. He recognised very early that it would help manage any outbreaks in the school, and it would also help to isolate particular bubbles rather than sort of having an impact on the wider sort of cohort. So, if schools choose to wish to retain their bubble system, then that's absolutely fine for them to do that.
Patrick, is there anything you wanted to add to that answer?
I'm sorry, and I then drifted off to the question on about the efficacy of the Delta variant. And to be honest, I'm probably not in a good position to comment on how the primary schools are managed anyway. It's sort of outside of my expertise, to be honest, Ian.
Okay. There is a question though here in the chat from Shalina, who's a mother of twin girls aged 15 with Down syndrome, and she's interested in where she can get her daughters vaccinated. She lives in Heston, and I'm assuming they attend a school in Twickenham.
Oh, now Heston. So Heston's going to be Hounslow, probably, isn't it? So she probably needs to. They are eligible now. So the first thing to do is to contact your practice, and your practice there will know where locally is available for you. I can tell you what sites are available here, and if you have problems accessing it locally, please come back to us through this meeting. But if you go to your GP in Heston, the 15-year-old with Downs is definitely eligible for vaccination now. So contact your practice in the first instance.
And I could see you typing the answer to the question on the efficacy of the COVID vaccine. So the question is, the COVID vaccine efficacy and effectiveness is reported in the news to be declining and might wane over time. And is that being considered? I don't know if you wanted to answer that for everybody.
Yeah, thanks. Maria's clearly completely on the ball here, so great to know that we got an informed audience as well. So absolutely right. The two main vaccines have lower total efficacy against the Delta variant than they did against some of the early strains. But the key part with COVID is protection against the complications of it. So even though the numbers in Richmond, I think, are running at something like 240 per 100,000 of the population, and that has not been manifested in increased numbers of patients needing hospitalisation. So the good news is that the vaccines, while they may not give quite such total protection against infection, they unquestionably are protecting against the complications, and I think we can live with that. You know, we've lived with lots of other viruses around, and it would be lovely if we never got any viral infections, but I think as a population we can probably live with getting the odd virus, as long as it doesn't have lasting implications for us. So it would be the hope, though, the interesting thing about this, with this new technology of the messenger RNA vaccines that I referenced earlier, and with the capacity to DNA sequence earlier, the expectation of the drug companies who make these products is that they will be able to manufacture new vaccines that will be effective against new variants far more quickly than they would have done previously. So we try and do this every single year with flu, and that's been quite challenging. In some years, the flu vaccine has been relatively ineffective, and overall it has an effectiveness of about 40 to 60%. But there have been some years where it's been very low in terms of the protection that it gives. So it's important that we are able to keep the vaccines up to date. So at the moment we're okay, even with the Delta variant, but the technology is being used to try and stay ahead of the curve. That's the principle, really.
Thanks, Patrick. And then there's one last question in the chat from Victoria about after school clubs, which is I'm not going to ask you to answer this, Patrick, you're all right. If the guidance has changed, I wonder why some schools are not providing after school clubs while others are. It's very difficult for working parents to manage when individual schools take these decisions. It's also quite confusing when schools already have wraparound care. They're just not offering after school clubs. So I think if I were answering that, I am answering that question, I think we were expecting some detailed guidance from the Department for Education before term ended in July about all kinds of issues for schools, including wraparound childcare and after school clubs. And unfortunately that guidance didn't arrive. It's still not arrived yet. And so I think schools were waiting for that guidance before they made significant decisions. I would say that schools have to make individual decisions based on their local circumstances. So the size of their school, the amount of space they have, the amount of teaching or other staff that they have, whether they've had to prioritise other activities like testing, which means that staff have been redeployed elsewhere. But I know that schools are really keen to get back to as much normality as they can at the beginning of term. So they will be making decisions around opening after school clubs. And from my discussions with head teachers, they're all keen to do that as quickly as they possibly can. So, I mean, if you're concerned, Victoria, about a particular school, then I would suggest you have that conversation with the head teacher at the school to see what their plans are for reopening after school clubs in their locality. And indeed, if they need any support, then services in Achieving for Children will be able to help them with that. Okay, and then there's one last question around whether we'll share the slides and the information from this event, and we will certainly send them around to everybody who has registered for the event after this evening. So let me just check, are there any more questions from anybody? Or has Matt and Patrick done a very good job in answering all your questions in their presentations? So Cheryl, I can see your hand is up, just wait to be unmuted, and then you're unmuted, off you go.
Just a quick question. I know that it's not approved yet, vaccines for under 12s, but you might hear from my accent, I'm American, so my child's cousins will have the vaccine. They expect sometime in the next 6 months in America. And is there anything possibly you might be able to tell us about that? Maybe not, but I thought I would ask.
Yeah, well, that's definitely for Patrick.
Thanks, Cheryl. I love America because America typically introduces drugs a little bit quicker than we do, and that's great for Americans who get access to good new drugs. There's always that slight risk that they may therefore also get some of the see some of the sort of complications a little bit earlier, but you know, it helps us certainly, and that happens. I think you're right. I think in all probability they will start offering vaccine. They will start looking at the safety data around vaccinating children under 12, and hats off to the Americans for helping us with that, really. The stuff I've seen so far is positive about the safety in those younger people. The approach that the JCVI have taken is that they've just gradually worked their way down and assimilated the data for each population, and then extrapolated the safety according to the previous group. So I suspect that we will do, but you know, I can't absolutely predict what the JCVI will do, or indeed when they will do it, but I wouldn't be at all surprised if we are vaccinating under 12s in the not too distant future.
Thanks, Patrick. So I can't see any further questions in the chat, so I'm probably going to call this to a close. Oh, I can see one appeared in the chat now from Jessica. So I submitted a question about whether parents of secondary school children will be supported with homeschooling provision if the children have been in close contact with someone who has tested positive. I have an 11-year-old child starting at secondary school next week, and I am a carer to my 93-year-old mother. I'm worried about the risk to my mother if my daughter has such a close contact, and would like to know if I can keep her at home and still educate her. So that is possible. So that is a conversation for you to have directly with your child's teacher in school. So yes, it is possible for your child to remain at home if that child poses a risk to somebody living in your household, and that the school can switch on their remote learning offer for your child. But you need to have that conversation with your child's new secondary school. And I'm assuming that that secondary school is in the borough. I can only answer for schools in the borough rather than from schools outside it. Okay, last call for any other questions. Grey Court, so it is in the borough, yes. Great, so just leaves me to thank Patrick and Asthma for their presentations this evening, and to Ellie Firth for hosting us. And to all of you for coming and for answering such or for asking such good questions. I hope you found it useful. We'll send the information out that we shared at the meeting to you by email. Have a good evening. Thank you.
Thank you.